My patient of the day today is a little 8-month-old with milk and soy allergy. So this bub had skin prick testing and they had a wheal response to, and that's the circle that comes out when they prick them with the protein, a wheal to milk and soy. And when this little one actually ate a tiny bit of Greek yogurt, they had mouth swelling, had to go to emergency, they had vomiting, had rash, so they had an anaphylactic reaction to the dairy protein. So very serious reaction, and mum was seeking my help to work out how to introduce solids to her little one given these reactions. So mum's still breastfeeding, and surprisingly bub still tolerates the dairy and the soy protein through mum's breast milk, which doesn't often happen, but it's great in this situation. So and at the moment the baby is having 3 breastfeeds a day and 3 solids a day, and generally at the moment it's after the breastfeeds, so more at snack times, but still very much on the pureed soft consistency. So we had lots to talk about today. We had to talk about how to give her a milk and soy free diet and make sure that her calcium requirements and her milk substitutes were appropriate moving forwards as she introduces more solids. We also had to talk about transition through the textures, because developmentally we need to move her to more textured foods. So we need to start putting in some finger foods alongside her congee that she was having multiple times a day. We needed to talk about iron-rich foods to make sure that Bubs was getting enough iron in her diet, because babies are very needy from an iron perspective. Excuse the lovely bird in the background, because babies have quite high iron requirements relative to their body weight. So we need to make sure that babies are getting enough iron-rich foods. I also had to start her on Ostalin Infant to pop it on mum prior to a breastfeed once a day, because vitamin D is very important for babies from an immune perspective, linked to allergies. And Bubs wasn't on vitamin D, so we needed to start her on vitamin D. And I also talked to her about starting an LGG probiotic, given Bubs also has eczema and food allergies, because that's going to help from a gut health perspective, tighten those cell junctions and thicken the mucus layer and help the gut become more relaxed when food proteins come in and not have an allergic reaction to these food proteins. So we talked about starting on a daily probiotic as well. So texture progression, keeping away from the milk and soy containing foods. We talked about a milk substitute such as Oatly, which is a calcium fortified oat milk that she can start to use if making say Wheat Bix, for example, or custard, for example, for her little one as she starts to broaden her variety of foods. Mum did ask me about her variety of foods to make sure that she was giving her enough, and I said, well, we actually do need to keep expanding her variety of foods to make sure that she's getting good exposure to a wide variety of tastes and textures, because we know that the greater the variety of foods that little ones are exposed to, the greater the variety of foods that they're going to accept and eat when they're older. So I did talk to mum about giving her a good variety of different foods, trying a new food every couple of days or introducing another new food every couple of days to make sure that the variety was there, and to let her get messy with food. So if she does have her, for example, her congee, and she has finger foods next to it, let her get messy with them, because babies need to explore food with all their senses, and that's the way that they're going to accept more foods into their repertoire and be less fussy later on. So I talked about making sure that we get that variety in, because it's important. We also did talk about fluid, because Bub's poos were sometimes a little bit firm, so we talked about offering her some water with a sipper cup at main meals, and that's separate to the breastfeeds. And she'll be getting most of her fluids still from the breast milk, but it's good to offer water with those main meals to help increase her overall fluid intake, so that she's meeting her requirements there to keep her poo soft. So we covered lots of ground. I'm just trying to think, there was probably one other thing that we talked about, but yeah, we covered lots of ground, and I feel like it was a really helpful session for mum. I also I'm going to email her the link to my Introducing Solids webinar, which she'll find very helpful because it just reinforces a lot of these concepts that we talked about. Actually, that was the other thing we talked about, was making sure that she's got all the allergenic foods in. So she'd already introduced egg and nut and fish. I hadn't done shellfish or wheat yet. And as Bub's only 8 months old, that's okay. Egg and nut are more important to get in early. And I said to her, just start to put in wheat and shellfish, you know, in the coming months. But again, one at a time, so that, and in the morning, so that you can observe Bubs over the day, just to make sure that there's no reaction. And also make sure you give a good 5 or 6 exposures every few days. Give her another exposure to that food. Don't just give the food once and then have a big break and then give it again, because that can also increase the risk of allergic reaction. So that's a summary of my case from today. And yeah, as I said, it was a really helpful session for mum. And if you feel that this could help you, if you've got a similar case and this could help you, if your bub's got allergies and issues similar, then reach out. I'd love to help. See ya.